Hey guys, so welcome back to Queen's Concussion Awareness Podcast. So my name's Zach, and I'm alongside here my co-host Joel and our special guest. And just before we get into it, for those that don't know, this podcast aims to raise awareness about the impact of concussions and end the stigma surrounding the often misunderstood injury. Concussions are a form of traumatic brain injury that can occur from a blow to the head or a violent shaking of the body. Unfortunately, many people still underestimate the severity of concussions and fail to recognize potential long-term consequences of not taking proper precautions. Our podcast aims to kind of change this by sharing stories and experiences of individuals who have suffered from concussions and the challenges they faced during the recovery process. And we also invite experts in the field to share their knowledge and provide valuable insights on how we can prevent, diagnose, and treat concussions. So join us along this journey and explore the world of concussions, learning from experts and sharing stories of resilience and hope. And together we can kind of create a community that prioritizes the importance of brain health and empowers individuals to seek help when needed. And so now I'll pass it over to Joel to introduce our guest today.
Yeah, hello everybody. Today we're lucky enough to be joined by Alan Champagne today, who is an MD/PhD student at Queen's University, which he's in his final year for. He's a former NCAA D1 football student athlete and Moorhead Keynes Scholar from the University of North Carolina. He's also the co-founder and executive director for the Concussion Education Safety Awareness Program. And he also does research that seeks to integrate neuroimaging, helmet accelerometers, film analysis, and motion capture to characterize the effects of head trauma on brain health, while uncovering the impacts of biomechanics and sport-specific mechanisms of injury in athletes. So quite the impressive resume you built up here for yourself, Alan. Would you mind introducing yourself?
Yeah, thanks. I mean, Joey, and first of all, thanks for having me. It's always great to see that you guys are advocate like this, trying to make a difference in the community and raise awareness. So it's always I raise my hat to you guys. Yes, I think everything was said. But my name is Alan. I'm from Montreal. Played football for the Tar Heels for 4 years, and kind of got interested in the idea of concussions, given their threat to the game and the game being close to my heart, and something that kind of took me out of the where I come from. So I value it, and I think it's worth researching. So I think my expertise and my training over the years has provided different insight, a different perspective, perhaps, to the field. And like it was said, I'm a final year MD PhD at Queens. I've been here for about 6 years now. On my way out, going into orthopedic surgery. So I'm pretty excited for the next move.
Nice, very cool. But just looking at your football career, was there any sort of time where you have to take a break from football due to a concussion or any of your teammates or anything like that? And would you mind just describing the experience with that?
Yeah, of course. Luckily enough, I think people always ask me that, but I have never actually suffered a concussion, whether it was in sports or off the field. I obviously have seen many teammates go through the process, and as a coach, I coached at Queens for about 4 years, and I've had many players go through the process, and as a clinician, I've had to manage or at least co-manage and help manage some of those patients. So, it's the injury itself is misunderstood for many, including clinicians, and something that the field has continued to grow. We're definitely better than we were a couple of years ago, but we're definitely far away from where we want to be. It's complex, it's multifunctional, it's multifactorial, and it's obviously increasing in incidence now because I think we're more aware, we've been diagnosed better, and we're more precautious about it. But it's I think it's calmed down now a bit. But as you guys know, over the last probably 5 to 10 years, it's gained a lot of momentum in terms of awareness from social media and the movies and the NFL and the professional leagues, and all the way down to high school and youth. So it's definitely a concern. It's a healthcare concern because of the cost it puts on the healthcare system, but more importantly because of what it puts the patient through, both in terms of the acute symptoms and some of those that are more chronic, which I'm sure we'll talk about later. But from my personal experience, no, I've never suffered or faced those symptoms, but I have been part of those stories for many, and perhaps those are the things that both inspire my research, but also because, as I said, I think the injury itself is a threat to sports. It's a threat to social involvement in sports, and as we can see it with organizations that are trying to cancel sports, their number one argument is always, head injury. So as an advocate for the game, as an advocate for sports in general, my job is to provide, or at least look for the evidence, and then find ways to make the game safer. So I guess that's my role in the big picture.
Yeah, and like that's pretty impressive going through all your years of football and even in NCAA and not taking any time off for concussions. Like that's pretty rare, I would say. And so
I think it depends, right? Like you have to be careful. Like there's a lot of players. Like think about how many people play in the NCAA. I mean, every team has about 135, 140 players on the roster. How many teams are in the NCAA? I mean, I don't know how many. So the incidence of concussion, I mean, is there, but it's common enough to have players that play and never suffer a concussion. I mean, some people will go with like undiagnosed injuries where they maybe had a what they call a stinger, or they had a kind of a hit where they're like, oh, I'm not sure what happened there, but and I've had hits where I was like, oh, that was a big hit, like that shook me up a bit. But to me, at least, when I think about it, both from an athlete and from a clinician standpoint, is that there's a difference between a big hit and a big hit that makes you symptomatic. And I think we have to be very careful in how we, people always say, oh, I remember this hit, and people tell me their stories, like I remember this hit, I saw stars after, but I kept playing, and I was like, did you ever have like a headache? Did you ever have any kind of symptoms? He's like, no, I felt totally fine forever after. So, that truly isn't a true concussion to me. I think again, and we can talk about the nuances there, but you always have to be careful in how we think about it. I think concussion are there, they're an injury, they happen, but going through a football career without a concussion is, it's just like going through a football career without an ACL injury. I mean, people have to tear their ACL all the time, but if you're safe, if you're lucky, depending on how much you play, what position you play, where you play, playing in the South, it's big time football down here, so the risks are a bit higher perhaps, but I think there's just so many factors that come into play, so we just have to be careful in how we talk about it.
Yeah, and like that also kind of brings up the point of like the difficulty diagnosing the concussion, but we're gonna get into that like later in the podcast.
Sure.
But
yeah,
how did you find how did you find concussions being dealt with at the NCAA level?
Oh, I mean, it's like it's no jokes down here. I mean, UNC Chapel Hill, where I played, like I said earlier, is led by the concussion program here is led by Dr. Kevin Guskiewicz, who's like one of the guru in the field of head injuries, and he's been my mentor for 10 or 15 years now. He's now the dean of the school, but back when I was there, he was like the head concussion researcher. He sits on most NFL or professional football panels. He's the guy that's responsible for the rule changes. He leads all the big research about concussion. So, at UNC, and just like most likely every program in NCAA, concussions are really taken seriously. I mean, they understand the risk for players. Where we have all these different tests and these different baselines and these different sensors on the field and all these trainers, and we have spotters, and I mean the resources here are just limitless. So for something like concussions that can really take your players out and make a big difference from an outcome at the game, but also at the competitive level for your athlete, that's not something that's taken lightly. So we have it's a multi-dimensional team that's we're all working in sync, and we still face the same challenges with like having to tell a guy that he has to sit for the rest of the game, or some guys won't say anything. They'll get a big hit, they'll get a big or maybe a small hit. It doesn't have to be a big hit, actually. That's always a misconception. But, there's actually no force or threshold that will trigger concussion. It can go from a 5G impact to a 300G impact, which speaks again to like how many things have to play in the actual symptomatic impact. But so I think we deal with those challenges, but at the end of the day, they're taken very seriously. They're dealt with extreme care. And with respect to post injury, rest, recovery, training, tracking, monitoring. I mean, you have like the team trainers, you have people that are tracking you on a daily basis, you have the team physician that's on there, you have the team consultants that are on there. You just have so many people that have an eye on you, and if things needs to escalate, they obviously have access to any kind of medical care is needed. So I would say it's still an issue. We see that we saw again this year, players going back to the field too early, players being pulled out, whatever. But we don't have this secret recipe just yet. But it's definitely something that's a priority, I would say, for most, if not all, programs.
Yeah, and like
At
that's
least in my
like
opinion.
great to hear. Just because like it's definitely, as you said, it's been the world of concussions has been like increasing and gaining track in recent years, and it's good to see that it's actually being like translated to the field and not just being held in research.
Yeah, I think any coach, obviously is very, very much aware of them. They're under they're under the gun for, from the parents, from the league, from the refs, from the researchers, from the health community. So I think everyone's got their eyes closely and everyone's watching, especially, I mean, the fan base and the viewings for, college football are so big, right? Like you have what, 100,000 people at the game, you have 1 million people watching. So every step is and they have replays and big hits, and so people keep it like a close eye for sure.
In your experience, did you sort of find that your teammates, if they took like a big hit to the head or anything like that, did you find that they would try to brush it off or tough it out or anything like that? Zach and I are both student athletic trainers, and I'm with the RMC rugby team, and I can often find not just with concussions, find that the athletes are trying to brush off their injuries, trying to avoid me, duck me out, just so they can keep on playing. Do you have like any experiences like that when you were playing, like with your teammates or anything like that?
I mean, like I said, right? Like I think football, rugby, hockey, I mean, name it. Any contact sports requires some sort of, some baseline of, character that's willing to undergo pain and push through that. We see that for any other kind of injuries, whether it's knee injury, shoulder injuries. People play with bad shoulders all the time, or bad knees, bad ankles. So I think that a baseline where we're kind of brought up and inherently biased towards hiding our symptoms, trying to push through. But I would say that over the last, 5 years, again, as we've seen, or maybe 10 years now, as we've seen the awareness for concussion develop, that's something that the guys are a lot more aware of now and will report. I mean, do you still have a player that's trying to hide his symptoms to finish the game because he just got his first starting spot and he doesn't want to lose it? Of course. I mean, I've seen guys come to me after the game. I've seen guys come to me the next day because they just never said anything. Or I've seen guys come off the field as soon as they got hit, right? So every player is different. Every situation is different. The cost of the game, their story within the game, what position they play, how close you are with them. But I would say that I would think now, at least from my experience, both as a player and a coach, that players are much more open and transparent for head injuries compared to other injuries. So, guys will play with bad shoulders for a long time before they start showing up because they know that you're going to send them for an MRI or send them to get checked. Whereas for head injury, they understand now, I think, that the impacts of not saying anything are much greater than the game. So, and I think they're a lot more understanding when you tell them like, hey, we should probably sit this one out or something. So, it's a transient process. It's continuously changing, but over the years, I think for the better, at least, guys are getting more transparent. So that's my experience, at least.
Yeah, and that's good to hear. Like, it's good to hear it's getting better. And just stepping outside from the concussion area, how did you find juggling, like playing NCAA football and doing your undergraduate?
I mean, there's no easy way. I mean, people, how many people have told me that it's not possible to do both and whatever. Like, I always tell people, people that tell someone that tells someone else you can't do this because it's too hard or whatever. All I hear when someone tells me that is, what you're telling me is that you can't do this because you think it's too hard, right? So that's your perspective, but don't put that perspective on me, right? I'll decide whether or not it's too hard. I appreciate the insight, I appreciate the feedback and all that, but don't let someone define your own limit because they think that's too hard, right? Like, I get up in the morning at 3:30 and I'm ready to go, and my wife always tells that to people for some reason, and they're like, "Why?" And I'm like, "Why not? Like, I can do it. I can sustain that stress on my body. I can sleep for 5 hours and be optimal and work fine, and that works for me." And so if someone tells me, "Oh, you need to do this and that," I'm like, "Well, that's your story, right? Like, let me write my story." So I think you have to be careful. I mean, playing football and school and volunteer and leadership, and I mean that's part of the game. Right? If you want to be the elite or part of the elite, or at least aspire to be part of the elite, you have to do many things, do them well, but you can't be overload. So I think I don't come from a lot. I don't come from a lot of money, so I don't really have a plan B. So for me, those extra work when guys were partying and going to the library, and I would go from the library to the party. Like I would go with my backpack straight to the party. I would kind of miss, the intermediate there. But and guys knew it, right? It was my thing. And is it hard? Yeah, of course it's hard. I mean, when people are watching a movie on Friday night, and at the hotel before the game, I was studying. I was studying plays for a little bit, and I was studying for school for a little bit, right? So you have to have your priorities in straight. And there's always three things to think about if you go to an undergrad or any kind of like schooling. There's the social aspect, there's the academic aspect, and then there's sports, right? And people will say you can never do all three things right. So one of them was have to sacrifice, right? So for me, priority was obviously academics and school and sports, so student athlete. But I like to party, so I don't think I cheated on my party scene. Like I think I did pretty well. But you just have to manage it. So guys go out, or my friends would go out, 4 or 5 times a week. Maybe I go out once, twice a week, right? So it's everything in moderation. And to me, my moderation was the social side, and then the school and the football was no joke. So I would never cheat that. But yeah, I'm not gonna sit here and say, "Oh man, that was easy." Anyone that tells you that, either they didn't play or they failed school, right? I mean, it's hard. But I like that. I like that lifestyle of like people. I like to be the guy that people ask, "How the hell does he do this?" Like that keeps me going. I'm like, "Oh man, I'll study a little more," because that feels good. It tells you that you're striving for the 1%, right? You're trying to be a bit different. And I always tell people, don't be average. And people that are average are going to be the people that tell you you can't do all that stuff because they're just average. So just don't be that guy.
I absolutely love that mentality. If you want to be great, you can't just be ordinary. But it kind of just drifting away from your time as a football player, looking at coaching. You mentioned your coaching experience with the Queens a little bit earlier, but how does managing a concussion with one of your players work from sort of a coaching perspective, and like what sort of the protocol and what's your role within that?
Yeah, I think that's a huge question. I mean, I think the coach is actually the most important player of the whole team with respect to the management. The doctor will diagnose, the trainer will follow, the head coach will keep an eye on, like indirectly, the parent will come, provide emotional support, the girlfriend will provide emotional support, the friends, good or bad support we'll see. But the coach is the guy, right, or the girl, whatever. But the coach is the father figure, or the parental figure that's indirectly present. The coach is created. When I was coaching, my biggest thing was always alliance. When my players came in on day one, my freshman came in, I was like, listen, now you're my dog. You're the guy that I take to the back alley. So you can tell me things, you can do things with me. I will take care of you. But when you need me, I'll be there. And so whether it's an injury or whether it's a bad play, whatever, like I would let them know. No bullshit. But that came down to like if a player is injured, you have to be there day one. You have to be so supportive, and you have to be okay with them just stepping away for a bit if they need to get that time to like recognize it. Because if you're the guy that's always putting pressure on them and yelling at them for stepping away, then like they're never going to tell you anything. So I was a big high energy coach, but I can recognize. I knew my player well enough that I could recognize when they weren't playing themselves, when they were being a bit like hesitant or whatever. They were like, oh, they got a big hit, they were shaking their head or something. Or you have to be attentive to those details, because then you can pick it up and say like, hey man, what's going on? Talk to me. So if you have a good alliance with them, a good relationship, they can just tell you things and they know you'll have their back, right? So I think if you ask any of my players, they would tell you that, I had their back, whatever it was. If a coach comes in and asks me about a player and talks, if anyone talks about my players, man, then that ain't going to happen. I talk right back. So, and for concussion, it's the same thing. If a player is injured, you follow them, you check on them, shoot them a text, see how things are going. Right. It's easy and sexy to be there on the big hit when everyone's like, oh man, what happened? You're kind of part of the hype a bit. But what about the next day? What about a week later? What about 2 weeks later? Right. So being that person, because you know them well enough to have that, and making sure, school's doing all right, checking in with mom and make sure, mom is doing all right. Mm-hmm. So kind of having, again, trying to keep in mind all the different pieces that are moving around them. If they have a girlfriend, have they talked to their girlfriend? Has she been visiting? Like, is she helping out? Does she know what's going on? Like, because all these things are going to help the player kind of go through it and be part of that support system, which I think we know is part of one of the most important things to get guys through those injuries.
Yeah, and I think just also as an athletic therapist, understanding your athletes is huge because, as you say, like you pick up on the small things they're not doing normally or how they normally play. So it is huge, kind of just understanding your athletes. And so
Yeah, and like the way the way they receive information, and if you're talking to them and they're just kind of being a bit off, and athletic trainers, they, especially in Canada, but you guys cover like almost the entire team, right? You guys are way overworked and way over diluted, so you'll probably cover like 50 to 100 athletes. So you don't have an eye for everyone, which you just can't, right? You have to keep an eye on the field, tape the guys, keep the guys on the sideline. So the coach, you have a much smaller unit, and so these are your people, and these are the people you have to take care of. So I think the coaches are the front line to this whole thing. So yeah, huge shout out to them and their role that they've been playing over the years.
And so, did you ever deal with any, like as you say, a lot of athletes kind of shake things off and they want to keep playing with just like bummed up shoulders and stuff? Did you ever find that you ever had any athletes that were potentially cussed or like from a big hit and that they're still trying to go out? And how did you kind of deal with that as a coach?
Yeah, I mean that's every player that knows how to play football. I mean, everyone wants to go back in, right? I mean, people are, athletes are competitors, right? They want to compete. It's game day. Like they've been working really hard, or even practice, but they just love to play. So, and then the hardest thing with concussion compared to like an ankle you can't walk on it and you feel the pain. You can kind of like associate the pain with the degree of injury, and you're like, okay, like I'm injured. I should probably take it easy, or I can't run fast enough to go do my 1-on-1, so I can't do it. The hard thing with like, concussions or sub-concussions, or whether it's a concussion or that kind of gray zone, is that you don't have a true injury. You don't have like a bruise, or you don't have you have some symptoms maybe, but it's I guess like relatively invisible in some ways, at the macro level at least. So it comes down to the same answer for that I gave earlier about alliance, right? It's about knowing your athlete and talking to them and say, look, if they trust you, whatever you say will go. If an athlete doesn't trust you, whatever you say doesn't matter, right? But if you've built a relationship over the years, over the months, over the weeks, to say that this coach got my back, he knows me, he knows what I want, he knows my goals, and he's got my best interest at stake, right? He's not just trying to cover his ass. And that's huge, because a lot of athletes may think, oh man, this coach is just trying to, I'm not sure, get in trouble, he's going to take me out, put someone else in. But the athletes knows, like, no, man, the coach champ is telling me I can't go right now because he understands my condition. He's worried about me. I will listen. So again, it comes down to alliance. And if you know your stuff, right, know your indications, know what to look for, and then know when to sit guys out, then people will trust you. And then you can always focus on things like the big picture, right, like their career. But for an athlete, that doesn't really matter at the time of the injury. What matters is what's the next step, what are we doing, and how it's going to go. So if you go back in, that's fine, right? That's your decision. But I don't feel comfortable with that. There's a safety risk, right, depending on the degree of injury, obviously. But you can talk about the consequences of multiple injuries, what can happen. Obviously, it can escalate. But you can also talk about the good picture, right? If you walk out of the field now, we can get you rehab right away. We can start getting you and working towards next week. And we need you in the game next week, right? So, there's many stories of guys that, have come off the field after the game and then, kept playing through it and didn't say anything. And a lot of times what I saw is that those recovery took a lot longer compared to guys that came out right away and didn't have any exposure after the hit and got to hydrate, be on the sideline, rest up, and then kind of get back into rehab the next day. So you just have to kind of keep that big picture. And then last thing I'll say is expectations, right? So when you start this season, when you start training camp, talk about this stuff. Make sure everyone knows the protocol and knows how to do things and how this team, what is the leadership going to do? And then it's a clean slate, right? There's no surprises. And so whether it's a big game or it's a live practice, it's the same rules. And I think if you're consistent and transparent, that will help everyone kind of be on the same page.
Nice. So kind of just building off that one. Just building off that one a little bit. You kind of mentioned a little bit earlier how coaches are kind of under the gun from a bunch of different external sources on concussions. As a coach, what sort of education did you receive regarding like the signs and symptoms of concussions, and how does that impact the way you approach, practice and games and things like that?
Yeah, that's tough though, because I'm biased, and my exposure to like resources was a bit, I guess skewed. But everyone's required to do the whatever they're called, the OUA like training, and everyone knows of the symptoms, and the trainers are really good about keeping an eye out for things, and team physicians on the sideline. So for me, how my expertise or my knowledge, I guess allowed me to be a bit different is that I integrated my knowledge for the injury and the risks of injury within my coaching, right? When we coach, the way we use the bags, the way that I coach technique for the game, the way that, coaching D-line how to use their hand and keeping their head away from contact, like all these things I integrate into my training and the way I coach my athletes so that they appreciated that not only they were getting better technically, but they were getting safer as a player. And if you put two and two together, then that just reduces your risk of injury. And I think being aware of those things of like, where do guys get hit? How do guys get hit? What kind of play do they get hit? What kind of tackle happens? What kind of tackle is associated with the highest risk of injury, right? Like angle tackle with your head across the body, all that kind of stuff. Like this is where the risks are are high. So if you focus on those and integrate those in practice, the guys will get better and better at them. So I think what I'm trying to say is that my awareness of the injury and my love for research allowed me to integrate the two and kind of use a data-driven approach for coaching and for the ways I help my athletes.
Yeah. And so like now, I guess going into the research, you just want to briefly kind of go over what your journey in research kind of was.
Yeah, it's been a long time. I was at Chapel Hill, UNC Chapel Hill, while I was playing ball, and I met this guy, Kevin Guskowicz, who was our kind of a concussion guy. So I worked with him for a couple of years, worked with the NFL. UNC has a lot of contracts with the NFL with research. Like guys like Roger Goodell would come in and kind of look at our stuff, and it was pretty cool. So I got a bit of a taste there, and I really enjoyed it. So I was always trying to go to med school, but I realized that my football career during undergrad kind of took a lot of me and didn't have time to do a lot of the other things that my competitors would do, like volunteer and stuff like that. So I took 2 years to go do a master's or partially a master's at Queens with Dr. Cook, who's one of the neurosurgeons at Queens, and he had an interest in concussion. So we started doing that, and then things were going well, and things were moving too fast. So I thought I needed more time, so I converted my master's to the PhD or the MD PhD program, which was the perfect balance of me kind of getting into medicine, which is what I wanted to do, but it's also getting more time to finish a PhD and grow things a bit bigger than I had anticipated. So, specifically our research focused on using brain MRI to look at, biomarkers for brain injuries, whether it was concussive or subconcussive, and then pair that with like impact biomechanics and understanding how head injuries or head impacts in general may change things in the brain, and how can we develop interventions or behavioral modification to lessen those head impacts and make the game safer. So, it came down to like a TED Talk. We involved the whole Kingston football community for like behavioral intervention, and so it was pretty cool. It was a really fun 4 years, and obviously, I'm in medicine, and I've kind of moved away a bit from concussion because of my clinical interest in orthopedics, but it's always in my back pocket, and obviously I'm hoping to do sports and trauma. So as a sports guy, I'll be on the sideline managing, orthopedics injuries. So being comfortable with the concussions and how to manage them and how to recognize them and how to handle the athlete will be just another tool that I can have in my toolbox. And then last thing I'll say is that, interestingly, as I told you guys earlier, there's some sort of a link between, concussions or concussion history and then MSK injuries, so ACL tears and things that orthopedic people will deal with. So I think there's a really neat niche there of research between neuroplasty and how the brain remodels post-injury, and perhaps how your things like proprioceptions and kinesiphobia actually change your risk of injury. So a lot of really interesting niche like research to follow in the future when I make some money and I can actually do things.
And just kind of like dive into it a little bit more. I know it's been a while, but did you find any promising results from this research and the biomarkers and different scans?
Yeah, I mean, we had lots of papers that came out. I mean, essentially, like we showed that in-season players that had more exposure kind of were like hypermetabolic, so their brain was just kind of needed more energy at baseline, which we kind of like which we extrapolated or speculated that would likely just given to more impacts, more not minor trauma, but just more things to repair. So what we did was then we said, okay, well, players that have players that get more impacts have higher markers. So what if we develop a behavior modification that targets those players that say, here are the things that you do bad that we need to fix so that you can reduce how many times you get hit in the head. And we use those sensors to help us kind of have a quantifying marker. So then we do implement those interventions that were data driven, and then we showed that we can reduce impact during practice. And so again, everything you just need data to show that things work out. But in the end, it was good.
And also, like, one huge aspect of research is knowledge translation, like kind of putting your research into actual field.
Yeah.
How what are your kind of thoughts on that? Because I know there is a fairly significant lag to it.
Oh yeah, I mean, I think that's the biggest weakness of research, and I think as personally, one of my things that I like the most actually is that piece. So I think CESAP was a big part of the knowledge translation, right? Kind of taking the education to the community, But the TED Talk that we gave in Montreal was another really nice opportunity to advocate and again, gonna stand on that red dot and translate what we had found to what we're going to use to change the culture or challenge the perspective. So yeah, I think knowledge translation is what most researchers really suck at. Because a lot of the field is based on like publications, and that's really our currency. But I always think about my mom. When I was a kid, she was working however many jobs she was working to keep us food on the table, and she's not going to go and read those papers at night, right? So how do you find ways for those moms to learn about the things that you do as a researcher that makes a difference in their sons or their kids or their peers' life? And that's the biggest challenge. But if you can do that, you'll be the greatest researcher, because who cares how many papers you publish? People will never the small community of researchers that know you, but the mass, the lay, the people in the community, when they hear about what you're doing, they see on social media, or they hear you in the news and they see what you're doing, they'll be like, wow, that's really cool. And I think there's nothing that's more gratifying as a researcher than that feeling to be like interviewed on whatever CTV to ask why your research is so cool, because you made it that cool, right? You made it look cool, and that makes a difference.
Nice. And just a last question before we start wrapping up. So we've been talking about the concussion education safety awareness program that you created. Do you mind just telling us about what this is and what brought you to do this?
Yeah. I think I mentioned earlier, but essentially, like when I was at UNC with Kevin, we worked with the football team here, high school team. And again, we did this whole behavior modification. Like went to see the team, identify guys that were kind of like high risk, and then fix their problems. And so when I came to Queens, I was trying to bring this U.S. mentality or this U.S. idea to Canada. And when I built the program originally, what I was hoping to do was to do just that, like go with teams, educate the players about concussions, and then go on the field and work on some drills to kind of like improve tackling and blocking and all that. So again, mixing my expertise in teaching and coaching and football. But what happened is that this program became an education program because of the name, right? Concussion education. So what we did is we ended up splitting it. We made CESAP, which was that education piece, become a key component in Kingston for school board. So CESAP is responsible for any kind of grade 9 education for head injuries and concussion as per Rowan's Law, which is a legal requirement as part of the curriculum. And then we built what was back then the Neuroprotection Project, which then became a startup called Elite Neurokinetics. It was basically a tech-based platform to use that, those behavioral intervention and that data on the field to make safer tackling and safer blocking. So, those two entities, were working in parallel. They were working on the same goal, but on different part of the game. So, it was a really good journey. It taught me a lot. Had to build down and build back up for many years. But at the end of the day, I think things worked out, and I think it made a difference, and it's still ongoing. We still have med students every year that kind of lead the way, and they go to the community and they teach concussion, and they work with things like Think First, which is a group in Kingston that works on head injuries, and with the school board. So it's nice to see that those fruits are continuing to grow.
Yeah, and that's great that you kind of brought something like that from the U.S. because it's definitely much needed here. And so, I guess that's kind of it. If you have anything else to add on here, Alan.
No, I mean, yeah, thanks for having me. Thanks for you guys for y'all's work. I didn't catch earlier what you guys are. I think Joel, you're a trainer, and I think Zach, are you a student?
Yeah, I'm also a student athletic trainer doing kinesiology.
So I think you guys are obviously onto something, and keep advocating for the field, and maybe consider doing some research in there to kind of learn a few more things. I would challenge the rest of your audience to continue investing in themselves and in both learning about concussions, but also understanding that sports are foundational. I mean, yes, sports have risks, and people always try to get me in trouble for supporting sports. But the truth is that sports are transformative for the community, for the people, and that even though they have risks, they also have benefits. And I think that, to me, at the end of the day, those benefits outweigh the risks. And the only way to make that even better is that we can work on the risks and we can make it safer. And the last thing I'll say is this: when someone walks across the street, what is the first thing that someone does when they cross the street?
Look both ways.
Yeah, they look left and right. And the reason why they do that is because they don't want to get hit by a car, right? Like, technically, you can cross the street without having look left and right, but your risk of getting hit by a car is just much higher, right? So that's a behavior that's inherently done to reduce the risk of injury. And I think the same idea can be applied to the field. We can make injuries less common if we work on the biomechanics, if we help people have safer tackling, safer blocking, better coaching, better practices, etc. And by doing so, we will continue to reduce the risk. And by doing so, the benefits of the game will continue to get better because guys will get healthier, they'll stop getting hurt, or they'll get hurt less often, and they can still work on things like teamwork, hard work, perseverance, etc. All the good things that you learn from sports. So I think that's the main message at the end of the day, is that sports are important and sports are crucial to the development of the youth. So we have to keep investing ourselves in them and not just quit because they create injuries.
Perfect. All right. Well, I think you offered some very inspirational insight here, Alan. Really glad you took the time here to join us. And thanks to the audience for taking the time to listen in.